Good morning. Today is February 22, 2022. A call to order the meeting of the Story County Board of Supervisors. Please join me if you're able in saying the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do I have a motion to adopt today's agenda?
So moved.
Second. I did that last time. Hens.
Aye.
Basil, aye. Now's the time for public comment number one. This comment period is for the public to address topics on today's agenda. If you would like to make public comment, please use the raise hand function, *9 on your phone, or step forward to the table. Seeing no one, will close public comment number one. Now is the time for agency reports. Mary Greeley Medical Center Home Health Services Annual Report. I believe we have Les White on the line. Good morning, Les.
Good morning. Hopefully, I'm having a few issues kind of fading in and out, so hopefully things will go well this morning and you won't lose me. I'll just go ahead and get started real quick. I know you guys have my presentation and Michelle said you would have that in front of you. The paper, I have another paper that I attached, and that just gives you an idea of what the numbers are in the programs that we provided this year in relationship to our asset funding, as well as it does show some of our Iowa Department of Health funding as well. These are just the numbers of those individuals that we serve in Story County. So my name is Les White. I'm the director of Mary Greeley Home Health, Hospice, and Story County Public Health. We service an area that is a 50-mile radius. So as you look at it besides Story County, we go over into Marshalltown, up over into Iowa Falls, around into Fort Dodge, come down into Jefferson, and then dip down. Usually we go into Ankeny, is about as far south as we go, and then come on up, and that completes our circle. Our mission is to advance health through specialized care and personal touch, and our vision is to be the best. I'll just do some highlights in relationship to our programming that we do. Home health services side, we of course provide skilled nursing into the home. All of my programs this past year have seen a decline in numbers. We really attribute that to COVID, as we did try to limit somewhat the number of visits that we made into the home. And we did that via offering a telehealth option. We also do provide services to those individuals that have COVID, but we find many times they just choose not to have us come to the home. When we're looking at our homemaker program, again, we stayed relatively stable there in relationship to COVID. On our annual survey, we were very proud. Our 2020 yielded 47.5% response rate, but we had it 98% of the individuals we served said that our services helped them remain in their home. We really look towards expanding our homemaker program. We have added another full-time homemaker, so that gives us 3 full-time homemakers. We've also begun a new service with that. We call it Hospital to Home Program. We have hired an additional person that we are sharing with our emergency department here at Mary Greeley, and we offer them folks from the hospital a ride home. The hospital purchased a wheelchair van, so sometimes it's difficult for them to get home. So we are providing that transportation. Once we get there, we can help them in. We can help them get their medications if they need to. If they need some assistance with food, those kinds of things, we are available to do that for them. So that is a program that we're just getting underway, and I look forward to reporting on that next year. So I think it's important with our homemaker program just to remember that it's not only the services that we provide to those individuals, but it really truly is that support and that personal touch, especially during these COVID times. I think our folks have very much enjoyed that interaction from our staff. The last program that's listed there is our transitional care, our surgical care program. That is provided by our skilled nursing staff. We do that in conjunction with Mary Greeley Medical Center to decrease rehospitalization rates as well as infection rates. Next is our hospice services. We continue to provide home nursing in the home, as well as we do go out to nursing homes. Again, that has been somewhat limited in 2020 and into 2021, really due to COVID. We continue to have our Israel Family Hospice House, where we provide 3 levels of care. We have our inpatient, our routine, and our respite care. Our average daily census for our home is about 21, and our average daily census in our hospice house runs around 4. With our bereavement program, that too has somewhat been halted, but we've been able now to get that back up and running. Mike did have one virtual meeting, and then he has held one meeting in person. And with that in-person meeting, of course, we had to limit the number of attendants, and you have to, provide your 6 feet and those types of things. He's continuing to look at maybe somewhere we can hold it that will be bigger so that our attendance can increase with that. We did, though, have our Tree of Love celebration in person this year, where we had it outside at the Israel Family Hospice House. We had 64 individuals attend. We were able to social distance. People wore their masks, and we actually planted trees on the ground in memory of those that were lost over the past year. We continue with our Honors Veterans program, where we provide recognition to those veterans that are in our hospice as well. And Mike will go out to the homes, provide bereavement in the homes, as well as providing any other bereavement opportunities within the community. Next is Story County Public Health. As you guys well know, our 2020 and 2021 were spent really handling COVID, and I really take my hat off to my team. They did an awesome job in relationship to that. With that, though, we have found that we needed some additional help. So we did hire a part-time RN to join our team, Jane Esserling Redding. And so I'm sure if you haven't got to meet her, you will get that opportunity. And then I did keep on staff 3 additional PRN nurses. I know that I had shared with everyone at one point or another that we did hire temporary staff during the bulk of when we were providing a lot of vaccines. And so we decided to just keep 3 additional people. And now we're able to have 2 people in the office every day. And then we have a team that can go out and provide clinics in the community as well. So now we really are in the part where we're transitioning more to that endemic model versus the pandemic model. And that really started with Governor Reynolds when she ended the state disaster emergency proclamation on the 16th of February. We will be moving to a viral respiratory pathogens reporting model. So in October, we will be reporting COVID, just like we report the flu or RSV. Any of those respiratory conditions we will report, COVID will be a part of those. There will be and is no change in our COVID response dollars, so we will continue to have the same amount of dollars that were promised to us through COVID. And there is no changes in relationship to the vaccine allocation. So those vaccine allocations for the county will continue to run through Story County Public Health. And the test kits, we will continue to provide those test kits to the individuals of Story County. There is no change in those as well. What has changed, though, is we will no longer be reporting long-term care outbreaks. They are required to send those to the CDC, so they will no longer report those to the Iowa Department of Public Health. Also, we are no longer reporting negatives. So with that, I used to report a positivity rate, a 7-day positivity rate, as well as a 14-day positivity rate. We will be no longer doing that since those negative tests are no longer reported. We will continue to see positive tests, variant data. They will report deaths and as well as vaccine data. In addition to that, I just wanted to share a little bit too about our local public health contract. that is changing as well. This will be a 5-year transition where we'll be going from a fee-for-service model to more of a population health-based model. So what that means for us, it's going to be more salary supported rather than us going to see individuals. So a good example is our homemaker program. We in the past have used $55,000 of local public health dollars to support that homemaker program as well as our asset funding. We will no longer be able to do that. So I will anticipate in the next year, I will be looking at my asset funding and then transitioning um, some of those dollars into that budget. Another program that will no longer be supported is that transitional care or health promotion visits that we do. In the past, I've used about $90,000 of our local public health contract to do that. I will no longer be able to do that either. So I will be taking a look at that and seeing how that maybe would possibly fit into our new model. We just got our new work plan. And so we are in the process of meeting with our community partners to really see where are those gaps? Where could we provide some education or provide some type of programming that doesn't exist? And really where we're starting with that is we're going to focus on preventative health and looking at our needs assessment. So that community needs assessment we did. We've started to look at mental health, and we have met with some individuals in the county and seen what we can do to enhance that, as well as food insecurities or childcare. Um, this monies also will be used to continue with disease investigation. We do report every other month to the Board of Health what disease investigations, such as tuberculosis, that we do within the county. So we will continue to do that. Again, my goal is we do have till fiscal year 27. I really hope to get this managed and transitioned within the next 2 years. And so I will again continue to report that. Yeah, Lisa?
I got a question here before you move on.
Yes.
I know I'm not quite understanding this particular area. So is it a change in service? Are you looking at a reduction or a whole model change in your delivery of service?
Mhm.
Because when you say a fee for service to population based, I'm confused by it.
Well, you know what? I was too at first, and I can't say that I have it 100% down. Because it is, again, fairly new. We just met again with our regional director, Heather. But the best way for me to explain it is my goal is not to reduce service. But yes, they will not pay for us to provide a direct service to a particular population. Like, for instance, our homemaker service is based on income. And so, and for the majority, that's our elderly population that we're serving there, that will not be supported. So I don't have any intentions of pulling back that program. We do get funding from Asset. Like I said, I'm going to look and see where I can continue to support that program as we feel it's very valuable in the community. When we look then at more of a population based, it's how can we use those local public health dollars to meet the needs of the entire population? I think one thing that COVID did do for us um, is it really brought public health to the forefront. And they want to make sure that we are able to use those dollars to provide a healthy environment for the entire county. Does that help a little bit in relationship to this transition?
It helps a little bit. I think as you're working with Heather, things flush out a little bit more. I can see a little bit more kind of the structure of what this is going to look like.
Yes. So what I will do, Lisa, definitely, this plan will have to go through the Board of Health and to get approved. So right now, we just got our work plan. Actually, we got it maybe 2 weeks ago, about a week ago, actually, probably. We met with Heather last week and we had just got it. So we're just in the process of trying to read and incorporate and see where these things will do. Now, it will continue to support like our disease investigations, which is great. Um, our funding, like for the vaccine clinics, that's a different public health grant contract. So that's different. So it's really, truly those things that we provide direct service to individuals that we need to be looking at and adjusting. So I will more than happy as we learn about this and as we grow to understand it, you guys, I will surely share that with you and let you know how things are going. So
Les, those changes are coming from the state level?
yes,
then?
that is correct. That is correct. And as public health departments, too, we are really one of the few that continue to have a public health that supports like a homemaker program, that we are still connected. Our public health and our home health are together, and it's always worked very well. Um, in many counties, those have started to separate, and for various reasons. So that too probably is one of the reasons where they were looking at this funding and changing it up. But like I said, my goal, not to eliminate any services that we provide. We will figure out the funding for it and then continue to move forward. And then you should see my team out more in the county providing preventative education programs and to the entire county. So more to come. That's what I'll say. More to come, and I'll keep you updated.
That'd be great. Thank you.
Sure. And if you have questions, you can always call or email. Another slide there just gives you an update of where we are in relationship to our vaccines for COVID. Really, we have done fairly well. My goal was always to get at least 75% of the county to have that first series. We haven't reached there yet. We're at 62%, but I will tell you that number does increase. I just heard somebody in our office today that this was the first time that they had been in to get a vaccine. So we continue to see those numbers increase. When we look at the entire population fully vaccinated, that means that they have gotten their booster as well. So those that qualify for a booster have gotten their booster, and we're running at about 44%. So again, we continue to offer COVID.
Oh, Les, you keep freezing up on us. Probably is fully frozen. Okay.
I wonder if you put a chat in and
Yeah,
we can go on and do a couple things, and if she agrees, we can go back to her.
yeah, that sounds good. Can you just, oh, we lost her entirely. Well, it won't do any good to put a chat in, because she won't be able to see it if she joins back. If she hops back on, we'll go back, we'll come back. So next up, we have consideration of minutes from February 15th.
I move approval of the 15, 22 minutes.
1 second. Hens, aye. Paisel, aye. Next, we have consideration of personnel actions.
I move approval of personnel actions as listed.
Second, Hens, aye. Paisel, aye. Moving on to consent agenda.
I move approval of consent agenda items as listed.
Second, Hens,
Aye.
Paisel, aye. Next, we have no public hearing items, additional items, departmental reports, other reports. Any upcoming agenda items? So now we're moving fast. We're at public comment period number 2, comments from the public on items not on this agenda. The board may not take any action on the comments due to the requirements of open meetings law, but may do so in the future. If you would like to make public comment, please raise your hand on Zoom, use *9 on the phone, or step forward to the table. And seeing no one, we'll close public comment number 2. Liaison assignments, committee meetings, updates, and announcements from the supervisors.
Sure. you want me to go first?
Yeah, that would be great.
So I have a asset interview this afternoon, and then I have another meeting over in Ames, and then Ames Conference Board meeting tonight. Tomorrow afternoon, I have assessor interviews over in Ames, and then we have the county assessor meeting last night, or that night. Thursday, I've got a 6:30 a.m. assessor meeting. Then I have a FERDA meeting. Looks like we have a NACO meeting, and then I have CICS in the afternoon. Friday, I have a meeting with the mayor and Beta in the morning, and then I have a Story County courthouse security meeting. And then I was thinking on Monday, the 28th, I would like a meeting that night. Pretty busy
Yeah.
this week.
Busy week. Yes, I have all of those, or most of those. There are several like webinars being offered on the new infrastructure bill. So I've kind of got those webinars scattered around my calendar. I can share those with you if you'd like. Tomorrow morning, I have a website redesign consultation meeting, wellness committee meeting at 10, and then conference board tomorrow night. I have some personal appointments Thursday morning, and then the NACO leadership meeting, another website redesign meeting at 2 o'clock tomorrow. One of those webinars at 3. Friday, I have our first Go Green Team meeting. And just a couple of other random meetings. Monday, we also have, I've got a CCJ grant committee meeting Monday, and then we have a meeting with Bridge Home at 12.
I don't have that down. Is that just,
I can forward it to you.
okay.
But yeah, another busy week.
Did we get last time? We don't. Okay. Someone else from your Greeley up there. I don't know if they would have anything.
Eric, did you have anything to add on the public health or Greeley side of things before we adjourn?
I was saw he was up there.
Okay. Well, with that, I will second. Hens, aye. Basil, aye. We are adjourned. Thank you.